Hello, I'm Ryan from 60 Minutes. On today's episode, we'll be talking about Leach-Nyhan syndrome. We will be interviewing a person with a family member that was diagnosed with Leach-Nyhan syndrome. Finally, we will also interview an expert on the Leach-Nyhan syndrome disease. Thank you. Leach-Nyhan syndrome is a condition that occurs almost exclusively in males. It is characterized by neurological behavioral abnormalities and the overproduction of uric acid. Uric acid is a waste of product of normal chemical processes and is found in blood and urine. Excess uric acid can be released in the blood and build up under the skin and can cause gouty arthritis. The nervous system and behavioral disturbances experienced by people with Leach-Nyhan syndrome include abnormal involuntary muscle movements such as tensing various muscles, dystonia, jerking movements, chorea, and failing of the limbs, bullosimus. People with Leach-Nyhan syndrome usually cannot walk, require assistance sitting, and generally use a wheelchair. Mutation in the HPRTI gene causes Leach-Nyhan syndrome. The HPRTI gene provides instructions for making an enzyme called hypoxanthine. Let's just cut that out. Now we will be interviewing Dr. Jared.
Hello, I am Dr. Jared Sargent, and I have been studying Leach-Nyhan syndrome for 10 years now. Mutations in the HPRTI gene cause Leach-Nyhan syndrome. The HPRTI gene provides instructions for making an enzyme called hypoxanthine phosphoribosyltransferase 1. This enzyme is responsible for cycling purines, a type of building block of DNA, and its chemical cousin RNA. Recycling purines ensures that cells have a plentiful supply of building blocks for the production of DNA and RNA. HPRTI gene mutations that cause Leach-Nyhan syndrome reverse in a severe shortage, deficiency, or complete absence of hypoxanthine phosphoribosyltransferase 1. When this enzyme is lacking, purines are broken down but not recycled, producing abnormally high levels of uric acid. For unknown reasons, a deficiency of hypoxanthine phosphoribosyltransferase 1 is associated with low levels of a chemical messenger in the brain called dopamine. Dopamine transmits messages that help the brain control physical movement and emotional behavior, and its shortage may play a role in the movement problems and other features of this disorder. However, it is unclear how a shortage of hypoxanthine phosphoribosyltransferase 1 causes the neurological and behavioral problems characteristic of Leach-Nyhan syndrome.
Now we will be interviewing someone that has a family member with Leach-Nyhan syndrome. How do you feel about this, my good sir?
My son Ernie was diagnosed with Leach-Nyhan syndrome 6.5 years ago. He's now 7 years old. He's unable to sit or walk unsupported. He is 100% dependent and needs to be cared for and watched 24/7. Ernie has almost all the hallmark symptoms of Leach-Nyhan. He has moderate retardation, is extremely self-injurious, and he attempts to injure other people. Has some spasm, speech impairment, and difficulty swallowing. And every day he has to wear all these protective gear just not to hurt himself or biting his fingers or banging his head or kicking other people. Yeah, that's about the gist of it.
Although there is no ultimate cure for this syndrome, there are many ways to treat it. Approach considerations, take action with your dentist, orthodontist, and doctor, consultations with your neurologist and psychiatrists, and lastly, diet and activities.
How are you feeling now, sir?
Oh, I feel so much better. I feel so much relieved because of the physical therapy programs and medication my son has been taking. My son has been taking allopurinol or gout medication to lower uric acid levels. He's also taking levodopa, diazepam, phenobarbital, and haloperidol to help the neurological outcome, like faster reflexes and spasms. Overall, he's been getting better. Now I can enjoy a lot of things that I couldn't have done with this, like gardening.
Well, this is the end of our 60-minute video. We have talked about the Leach-Nyhan syndrome and how it can affect the human body and how it can be treated. I'm Ryan.
I'm Jared.
And I'm Brandon.
And this is 60 Minutes. Thank you for watching.